Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Seeing a health department official at your door can be alarming, so let's talk about why they might show up at your house. It's almost never a random visit. A visit from the health department to a private home is typically triggered by a specific complaint or a direct public health concern. The number one reason is a formal complaint. This could come from a neighbor, a landlord, a tenant, or even a concerned family member. Health departments are legally required to investigate credible reports about situations that could pose a risk to the community's health. So, what kind of complaints would bring them out? First, and most common, are reports of severe unsanitary conditions. We aren't talking about a messy room or a few dirty dishes. This means situations like extreme hoarding that creates fire hazards and pest infestations, large amounts of garbage piled up inside or outside a home that attract rodents, or overwhelming odors that affect neighbors. Second, they will absolutely investigate issues with waste and water. A failing septic system with raw sewage leaking into the yard is a major biohazard they must address immediately. Similarly, if there's a concern that a private well is contaminated and making people sick, they may come to test the water. A third reason is a hazard within the home itself, especially if children are present. A report of peeling or chipping lead-based paint in an older home could trigger a visit, as lead poisoning is a serious health risk for kids. This type of call can sometimes be linked with a referral from Child Protective Services. Beyond complaints about the property, a visit can be part of a disease investigation. If you or someone in your household has a serious communicable disease, like tuberculosis or measles, a public health nurse might visit. They do this to provide information, ensure proper quarantine is happening, and perform contact tracing to stop the disease from spreading. This also applies to foodborne illness outbreaks. If a potluck at your home is identified as the source, they may visit to investigate. Finally, they may visit due to reports of an unlicensed business being run from your home, such as a daycare or a food service operation, to ensure it meets public health and safety codes. If an official does come to your door, they should identify themselves and explain the general nature of their visit. Their goal is typically to achieve compliance and fix the health risk, not just to issue fines. I hope this video helps clarify why the health department might visit a private home. It's almost always about protecting the health and safety of the entire community. Thanks so much for watching. If you found this information useful, please hit the like button and consider subscribing to the channel for more straightforward guides.